Join us now for Health for Life, brought to you by Hamilton Healthcare System. Today we're talking with Dr. Lisa Duhaime of Peeples Cancer Institute in Dalton. Thank you for joining us today, Dr. Duhaime.
I'm glad to be here, Bobby.
Dr. Duhaime is a board-certified medical oncologist at Peeples Cancer Institute at 1215 Memorial Drive on the campus of Hamilton Medical Center. She specializes in adult cancer and hematology disorders. She completed her internal medicine residency at Henry Ford Hospital in Detroit, Michigan, and her medical oncology hematology fellowship training at the H. Lee Moffitt Cancer Center at the University of South Florida in Tampa. Dr. Duhaime, can you tell us about Peeples Cancer Institute?
I sure can. Peeples Cancer Institute offers radiation and medical oncology such as chemotherapy and infusions,
Right.
Including immunotherapy, chemotherapy, biotherapies. We also offer follow-up care for preventative treatments, including mammograms.
Great. So you got board-certified medical oncologist, radiation oncologist, and you work with surgeons.
Correct. As well, the gastroenterologist in the area and the pulmonologist in the area help to give multidisciplinary care, as well as the neurosurgeon helps to give multidisciplinary care. We also have a tumor board that meets every other week, and on the alternating weeks, we have a breast cancer tumor board.
Now you get 3D mammograms and ultrasound imaging, correct?
Correct.
Wow, that is exciting. But while we're talking about mammograms, when should women get a mammogram?
Recommendations are that they should start at age 40 or 10 years before the first diagnosis of a first-degree relative.
Okay.
Or if they're high
What is
risk.
a first-degree relative? Would that be?
That would be a mother or a sister.
Okay, I got you. So if they were diagnosed before age 50, then they need to get it within 10 years of their mother or sister's diagnosis.
That's
is that
correct.
What I understand?
So if your mother or sister was diagnosed at age 45, you should talk to your primary care physician about setting you up with a mammogram at age 35.
I got you. Now, a lot of ladies that are listening may have never had a mammogram. What do you do to get ready for that?
You talk to your primary care physician about asking for a referral to schedule you an appointment at Peeples Cancer Institute, and they will refer you and they'll set you up with an appointment time. It is a beautiful new facility. You come in, check in at the front desk, and they'll walk you through the process. It's a beautiful facility.
Very good. That's at Peeples Cancer Institute in Dalton.
Yes.
Share with me the benefits of getting a mammogram.
Mammograms help to detect breast cancer before you could ever even feel it. A lot of times, women will be able to detect a breast cancer with a mammogram before it even turns into breast cancer.
Really?
Yes.
That is so important.
Absolutely. There are some women, if you wait until you can feel a breast lump, a lot of times it's what we would consider a stage 2. A stage 2 breast cancer is 2 centimeters or larger. And if you think about it, 2 centimeters is not that large. So in order to detect a breast cancer in an early stage, or even what we would call pre-breast cancer, which is ductal carcinoma in situ, a mammogram is essential. And that's when women will tell you time and time again that they thank God every day that they got their mammograms.
I'm sure of that. Now, if you've never had a mammogram, how long does that take?
Every time I've gotten my mammogram, the women there run a tight ship. They run on time, and they are so personable. I'm in and out within usually half an hour to 45 minutes.
You're kidding me.
It's wonderful.
Wow, that is wonderful.
And like I said, they are very personable, and they make you feel comfortable and at home. They keep you feeling that you're protected and private, which is very important for women because it's a very personal procedure for some women.
I understand.
So that prevents a lot of women from getting their mammogram, and these women understand that, and so they take that very seriously.
Sure. Yeah, that's very important.
Absolutely.
For so many ladies that are listening, and that mammogram is important to have.
It sure is.
And once you hit that age and you have your first mammogram, then you need to have it every 12 months. Is that right?
That's usually the recommendations.
So if you have it every 12 months, the most important thing is that they have that base to look at. So if you have the mammogram and everything is clean, then you go back next year and they can compare it with your past results.
That's correct.
Is that correct?
That's correct.
You know, a few minutes ago we talked about how women should prepare for a mammogram. There are other things they need to keep in mind, correct?
That's true. Something I didn't mention is that if women are premenopausal, they need to make sure that they schedule their mammogram around the time of their menstrual periods. They need to get their mammogram the week after their menstrual period. They also need to avoid wearing deodorant, baby powder, lotion, or ointment around their chest area. And if you find that mammograms are uncomfortable, consider taking some ibuprofen or Tylenol about an hour before your exam, because unfortunately mammograms can be uncomfortable.
Yes, but what you get at the end is just fabulous.
It is so worth it. If it can prevent me from going through what I've seen women have to go through, it is absolutely worth a couple minutes of uncomfortableness for once a year. I'll take it. Absolutely. One other thing, though, that women need to be aware of when they're scheduling their mammogram is if they happen to have something abnormal in their mammogram, such as something looks suspicious and their lymph node looks enlarged, they need to be aware that if they've recently had the COVID vaccine, those lymph nodes under their axilla on the side or under their arm on the side that they had their COVID vaccine can actually be enlarged for up to 6 weeks to 2 months after their COVID vaccine. So they should let the tech know that when they go in for their mammogram.
I did not know that.
It tends to make your lymph nodes enlarge because the lymph nodes are where your immune system builds up that protective response and stores it. So after you get that vaccine, that's where your body is storing those cells, those memory cells, to fight off the infection if you ever should get it.
And that's why they could be enlarged.
Exactly.
One of the things I want to bring up before the show is over today is that mammograms are not available at Hamilton Diagnostic Center any longer after so many years, because that you guys are taking care of it where?
At Peeples Cancer Institute.
Fabulous.
Because once again, we want to try to incorporate as much cancer care at the same facility.
Right.
And from beginning to end, and diagnosing it starts with the screening.
And you got plenty of parking right there at the door.
Plenty of parking, and it's easy access. It's a beautiful facility. There's a Starbucks right in the lobby.
Yeah, that's what I had heard, yes.
Patients love it. It's comfortable. It's quiet. It's peaceful. Patients are just much more at ease, and
oh, it's wonderful.
Yes,
Isn't
they're
it great?
happy.
As you were saying a few minutes ago, sometimes ladies feel like it makes them nervous about going
That's
and
right.
doing that, and they take good care of you.
That's correct.
Dr. Duhaime, we've learned so much today. Thank you for being our guest on the show.
Thank you for having me, Bobby.
Glad that you're here. For more information or an appointment at Peeples Cancer Institute, call 844-PCI-HOPE. And to make an appointment for a mammogram, call 706-272-6565. To learn more about Peeples Cancer Institute, visit hamiltonhealth.com/cancer. This program in no way seeks to diagnose or treat illness or to replace professional medical care. Please see your healthcare provider if you have a health problem. Thank you for listening to Health for Life, a presentation of Hamilton Healthcare System.